It has been 8 months since the first COVID-19 vaccine was given emergency use for authorization. Seems like yesterday and a century ago at the same time. But so much has happened since then. We have 2 more brands and expanded who is eligible to children ages 12 and up. But we are not done fighting COVID-19, and vaccination efforts continue across the state. In today's To Your Wellbeing, we're talking about the COVID-19 vaccine. Where are we now, latest updates, and what to expect going forward. Cone Health's Director of Pharmacy and Oncology, Dr. Harvin, joins us now. Doctor, what is the current state of the vaccine in North Carolina? How are we doing at getting people vaccinated?
Well, thanks for having me again. I appreciate it. I think the easiest way to say that is we're just not where we want to be at this point in time. We had tremendous efforts done across the state, had a lot of interest in the very beginning. We probably had more demand and supply. But right now we're at that point in time where really the demand has tapered off and to some degree diminished significantly. So right now, a little bit over half of the population in North Carolina that are eligible for it, right at about 56% have received at least 1 dose of the vaccine. About 58% of all North Carolina residents that are eligible for it are fully vaccinated. So still pretty far from our goal, but great progress has been done so far.
It is good to see the progress, but we're still talking about millions of people in our state that are not vaccinated. How concerned should they be, especially now with the Delta variant?
You know, the Delta variant is something that we keep a watchful eye on. It is here in North Carolina. It's extremely infectious compared to what we saw just a year ago from COVID-19. And this is what we worried about. When there's a lot of virus in the community, it has that ability to start to mutate and to bring up these variants that can essentially overwhelm things. It can spread faster. It can render vaccines less effective. Luckily, the vaccines that we have are still proving to be very effective against it. And so it is something to be worried about. You've heard a lot in different news segments that now COVID-19 is a pandemic of the unvaccinated. We see that here in North Carolina, that over 99% of people that are getting hospitalized and those that have unfortunately lost their battle to COVID in this last few months have been unvaccinated. And really the Delta variant is very much something that we have to be worried about.
So over 99%, that does mean there are still some people who are vaccinated and are getting coronavirus. Why is that?
Well, these vaccines are incredibly effective. When we came out, we said we're getting over 90, sometimes 95% efficacy, but that's not 100%. And so we've been very clear about that from the beginning, that although these vaccines are great, they're not foolproof. And we really need everyone to come to the table. Everyone that's eligible to receive the vaccine, we really need them to help us in this battle, because we don't know how much longer we can continue in this pathway before something occurs where another mutation may arise or another variant that may arise and start to render these vaccines a little bit less effective. But yes, there is such thing as breakthrough infections. It's exceptionally rare. Again, so now you're talking about less than 1%. It's less than probably like 0.5%. So it's very rare, but it is something that can occur in certain situations.
And it's also why we need everyone to get vaccinated, as you were saying. Can you explain what herd immunity is and how that protects us all?
Correct. Herd immunity is something we talked a lot about. People have heard it. They've pointed to it as, kind of early on in the pandemic, that we just needed to embrace it, with probably not knowing all the facts and how dangerous the coronavirus was going to be. Essentially, what herd immunity does is that once you reach a certain point, and it's really dependent on the virus itself, for coronavirus, we're looking at it's going to be probably greater than 85% of our local population, and really the nationwide population, that needs to be fully vaccinated before we can really even have a good understanding of what that herd immunity looks like. But herd immunity is really for those in the community that can't be vaccinated. So we think about the exceptionally young, those with comorbidities that don't allow them to get vaccines. They may have had significant anaphylactic reactions in the past, or they may have something in their medical history that just doesn't render them eligible for a vaccine. Herd immunity is that so many people in the community are vaccinated that the virus itself doesn't have the ability to jump to those that cannot receive the vaccine. And so therefore the herd, or those of us in the community, essentially act as their vaccine, their protection against this potential virus. But again, unfortunately, we're really far away from that if we don't have everyone coming to the table that's eligible to receive this vaccine.
Especially if you have young kids at home, it's really important to get the vaccine to help protect them, correct?
Absolutely, absolutely. We know children aren't as affected negatively by coronavirus, but they can still be spreaders, and there have been children that have gotten sick. So again, we want to make sure that we protect all members of our community that aren't eligible for the vaccine at this time, or they're just not able to participate in those vaccine programs.
So helping others is one reason, but it still helps you too to get the vaccine. I know that I've heard people say, I'm young, I'm healthy, my immune system will kick COVID, I don't need it. What would you tell them?
Well, I would say we would need to look to the science. And so early on, we just said, hey, this is something that we were seeing a lot of hospitalizations and unfortunately deaths in patients that were elderly, that had a lot of comorbidities. But we have absolutely, in this last year and a half now, seen patients that were very healthy. They were young, mid 30s, late 20s, that end up getting COVID-19, and it just overwhelms the immune system. It is absolutely possible. The vaccine is advantageous. It will take advantage where it can. And so not only does it protect you to get the vaccine, but we have to think about if you're young, well, how many people are you around that could be susceptible to that? Do you have a parent? Do you have a grandparent, a loved one that if they had COVID-19 infection, could potentially find themselves in the hospital and potentially overwhelmed. So again, it's about more than just us. I'm relatively young myself in my mid 30s and I don't have comorbidities. I was one of the first people in line because this is about us. It's not just about me. It's not about us as individuals. It's about us as a society, the United States of America, making sure that all of our patients and all of our population are protected from this really nasty virus that's out there right now.
I've also heard a lot of people say, I'm a patriot, I love the country, I want to help our community, but we just don't know enough about the long-term side effects yet of the vaccine. What would you tell those people?
Yeah, it's an interesting conversation. I could probably go in a number of ways about it. When I've had this come up before, I really say two things. I say, one, I can think of nothing more patriotic than really caring for my fellow man, my fellow neighbor. I don't care how you vote, what your politics are, what you believe in. We are all Americans. We're all in this together. And if I can take a safe and effective vaccine that protects my neighbor, my community member, my team member at the hospital, then again, I was the first in line to do that. And I encourage all of those that see that patriotism as something that they really want to bring to the table. The second aspect of it is that we have given millions and millions of doses of these vaccines across the world. And by and large, we have seen that they are both effective and exceptionally safe. One of the big things that we don't know is really what the long-term side effect of COVID-19 is. And I think that's going to be a bigger field of study than anything else that comes around this vaccine. We have seen incredibly healthy and young individuals have cardiovascular events. I've had members on my team that unfortunately contracted COVID-19 before the vaccine was eligible. And here they are almost a year later saying they're still dealing with symptoms. They're still having the lung and cardio issues. There's a lot going on. And I think it's going to be years until we really understand what the long-term side effect of the virus is itself. Because it is novel. It is not something that we have a ton of research on. So again, patriotism begins, in my opinion, with understanding and really caring about the person next to you that's also part of this country. And again, that long-term side effect of the virus, I think, is going to be much more detrimental than anything you would find from a vaccine.
So again, I just want to say, as a leading medical expert, you're more concerned about the long-term impact of getting the virus than you are of the vaccine.
Absolutely.
I know a lot of research has also said that most side effects of vaccines happen pretty quickly, and if they would have happened with this vaccine, they probably would have happened by now, correct?
Absolutely. When we look at vaccine-related side effects, the longest time period on record that we have seen in terms of study is about 6 to 8 weeks after the vaccination. And so again, we see it in a very short timeline. We know with this particular vaccine, most side effects, you're going to feel it that day or for the next 48 hours. And then again, after that, you're looking at 6 to 8 weeks. So about 2 months, if there is something that's going to occur, it would have occurred. We've now had these vaccines on the market for almost a year. Again, millions of doses have been given. So again, those long-term side effects, if they were going to occur, we would have seen them by now.
There you have it, a leading, well-respected expert in our community telling you that it's safe to take the vaccine. He's going to be here with us through 6 o'clock answering all your coronavirus questions. Text them to us, 336-379-5775.